Hello, everyone, and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. My name is Ann Potempa, and I'll be helping to facilitate the talk today. Our section's vision is for healthiest, safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. This webinar series was created to provide a way where we as public health professionals can have an open dialogue around specific projects and explore ways to work together. We will be offering webinars on the third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore opportunities for further collaboration. Another way you can stay connected to our work is through our monthly newsletter. You can sign up for the newsletter on our section's website. Our website address is at the bottom of all of our slides. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of open dialogue. The audio for this webinar should be coming through your computer or through the telephone number that was provided for you when you registered for today's session. If you have technical difficulties during the webinar, please let us know by using the question panel in your sidebar. You should have a section that looks like this on your sidebar. You will need a microphone on your computer, or you'll need to use the telephone number provided to ask a question out loud. All questions, except for those about technical difficulties, should be held until the end, and then we will have more time to discuss them. To join the conversation or to ask a question, please raise your hand. We've got a picture up on the slide to show you how. On the sidebar, you should see a yellow hand that you can press on. When that's raised, we'll start answering questions in the order they're coming. With that, I'm going to start today's presentation, and I will pass it over to Alaska Liendo. Alaska.
Good afternoon. Thank you so much for joining our webinar today, BRFSS and YRBS, using our surveillance tools to better understand health and social behaviors of adults and teens. My name is Alaska Liendo, and I am the coordinator for the Alaska BRFSS, and I will be sharing information about the Alaska Behavioral Risk Factor Surveillance System. Teslina Mannix is also here, and she will share information on the Youth Risk Behavior Survey. Next slide, please. As a quick overview of today's webinar, we will begin with the Alaska Behavioral Risk Factor Surveillance System. You'll also hear me refer to this as the BRFSS, followed by the Youth Risk Behavior Survey, also referred to as the YRBS, and then we'll close with a little bit of time for questions and answers. Next slide, please. First, I'd like to give a very brief background on the BRFSS. The purpose of the Alaska BRFSS is to provide timely collection and dissemination of data vital to program planning and evaluation across the state system, as well as by nonprofits, Alaska Native, and other non-state organizations. The Alaska Department of Health and Social Services first implemented the BRFSS in 1991. Working with the Centers for Disease Control and Prevention, the BRFSS gathers information about the health-related lifestyle choices of Alaskan adults. With this knowledge, we can better plan and evaluate our health promotion programs to prevent chronic disease and premature death. Today, the BRFSS is implemented in all 50 states, as well as some territories, as part of an ongoing data collection system. Each year, results are analyzed to improve our understanding of health habits and to measure progress towards health objectives at state and national levels. Next slide, please. The BRFSS Standard Survey is designed by a working group of BRFSS state coordinators as well as CDC staff. The questionnaire is approved by all state coordinators. Currently, the questionnaire has 3 parts. 1, the core component, which consists of a fixed core, a rotating core, and an emerging core. And I'll describe what these 3 different parts consist of. Number 2, we have optional modules. And number 3, we have state added questions. All health departments must ask the core component questions without modification in wording. However, the optional modules and the state added questions are in addition to the core and are, as it states, optional. The fixed core is a standard set of questions asked by all states that include questions on demographic characteristics, plus queries on current health behaviors, for example, tobacco use or seatbelt use. The rotating core is made up of 2 distinct sets of questions, each asked in alternating years by all states, and these address a variety of different topics. In the years that rotating core topics are not used, they can be included as optional modules. The emerging core is a set of up to 5 questions that are added to the fixed and rotating cores. Emerging core questions typically focus on late-breaking issues, and these questions are part of the core for 1 year and then evaluated and to determine their potential value in future surveys. An example of a late-breaking issue right now would be Zika virus. We also conduct another survey called the Alaska Supplemental Survey. This is an additional survey designed in collaboration with the Tobacco Prevention and Control Program to provide ongoing data collection on preventive health practices and risk behaviors, in particular detailed information on tobacco use, knowledge, and attitudes, which may contribute to chronic diseases among Alaska adults. Next slide, please. The BRFSS survey is an ongoing monthly telephone survey that utilizes a standard protocol and interviewing methods developed by the CDC. Although the main purpose of the BRFSS survey is to estimate the prevalence of behavioral risk factors in the general adult population, interviewing every single adult in Alaska would just not be economically possible. Therefore, we draw a random sample in which all persons have a known chance of selection. The BRFSS in Alaska uses a stratified random sampling design where our strata, or regions, include combinations of geographically clustered areas. Every single month, over 200 Alaska residents age 18 and older are interviewed over the telephone regarding their health practices and day-to-day living habits, to reach an annual sample size of at least 2,500 completed interviews. This sample size is the minimum sample that we need to ensure our data are representative of our state's adult population. The data are collected from January through December every year. BRFSS data are weighted to account for differences between the respondents and the population that the data should represent. We use a proportional fitting methodology, also known as raking, which improves the accuracy of BRFSS by allowing us to use more demographic variables such as education level, marital status, renter-owner status, along with gender, age, race, and ethnicity in our weighting. CASRO response rates are defined as the proportion of all eligible respondents in the sample for whom an interview is completed. Our response rate is consistently above 60%. And lastly, limitations. The main limitation of any landline telephone survey is that people without a landline phone cannot be reached and are not represented. In the BRFSS, this is accounted for by including cell phones in the BRFSS sample. Over time, the representation of cell phones in the sample has increased, approaching a planned 50% in 2017. Other limitations include self-reported information, where the potential for bias has to be kept in mind when you're interpreting results, as well as survey response rates. Next slide, please. Earlier years of the BRFSS produced printed reports such as health risk analyses pictured here. Next slide, please. Over time, the use of BRFSS data expanded to include planning for Healthy Alaskans 2020 goals. Many of the baseline measurements for the Healthy Alaskans 2020 goals were based on BRFSS data. Next slide, please. Another historical use of BRFSS data has been the publication of the BRFSS highlights. So every year after data have been processed and weighted, we provide summary information on some key indicators, noting the most recent prevalence rates, as well as how we compare to Healthy Alaskans 2020 goals. And a really exciting thing coming up is the 2015 BRFS highlights are expected to be published online this month. And finally, BRFSS data have been used in community needs assessments. These communities often look to BRFSS data to determine and address needs or gaps between current and desired health conditions in their communities. BRFSS data can provide important information to help communities set goals, to inform their planning process, and to track progress over time. Oftentimes, BRFSS has been the only source of data for statewide and regional estimates of health conditions and behaviors. Next slide, please. More recently, the BRFSS has expanded its reach by making data available on the World Wide Web. Anyone can access the Alaska Indicator-Based Information System for Public Health. This is also known as AKIBIS. And when you get onto this website, you immediately have a plethora of summary information at your disposal. So in addition to what you see pictured here, AKIBIS also provides statistical numerical data, as well as contextual information on the health status of Alaskans and the state of Alaska's healthcare system. Indicator reports on AKIBIS provide not only numerical data for the health indicator, but also its public health context, including what the current status is and then what's being done to improve it. Next slide, please. Another really interesting and useful web-based tool is Instant Atlas Health Maps. Instant Atlas Health Profiles make state, regional, and community-level health data readily accessible using an interactive interface. So you have visual indicators of color, size, location, and direction augment numerical and categorical data to help you better understand health risks, disparities, and disease prevalence in Alaska. And all information on Instant Atlas is available in both graphic and tabular formats, which makes it really nice. Next slide, please. And then going back to Healthy Alaskans 2020, BRFSS data is currently being used to track our progress over time and to compare our current health status to our Healthy Alaskans 2020 goals. Without BRFSS data, we would not have the ability to track successes or gaps towards a lot of these targets. Next slide, please. Going forward, we want to maintain the current uses of BRFSS data, but we also want to expand what we currently do. And one method of doing that is to expand AKIBIS and Instant Atlas. For example, there are currently 79 published health indicators on AKIBIS, and we fully expect this number to increase beyond 100 in the near future. The reason we've made the expansion of AKIBIS a priority is because it has proven to be a highly sought after and utilized information toolkit. We are able to track website visits over time, and we have seen the use of AKIBIS grow exponentially. We are excited to provide more data and to make it as accessible as possible to anyone who wishes to use it. We will also continue to track our Healthy Alaskans 2020 progress and work with partners to conduct collaborative analyses. Next slide, please. So most importantly, how can you use BRFSS data? We have a myriad of information available on the Alaska BRFSS website, and you can see that here. You can find information on survey background, methodology, historical publications. There's a lot you can explore on that website. or you can try your hand at AK-IBIS and Instant Atlas, both of which can provide you with detailed information on a variety of health topics. Instant Atlas is especially nice because you can customize your data query. And if you need help navigating either website, AK-IBIS, or Instant Atlas, I am more than happy to assist. You can call me, email me, and I can kind of walk you through how to do customizable queries. Finally, if you can't seem to find what you're looking for on either the Alaska BRFSS website, AK-IBIS, or Instant Atlas, you can always submit a data request. I can provide you with complete data sets, and this is usually the option chosen by researchers who have the ability to support analysts as well as analytical software. Or I can provide you with customizable information based on your specific interests, regions, etc. You can find the data request form on the website listed. All you have to do is complete that form and email it to me. And my contact information will be available at the end of the presentation. Switching gears, I'd like to now pass the microphone over to Taslina Mannix, who will provide you with information on the Youth Risk Behavior Survey. Thank you.
Hello. I'm going to speak to you about the YRBS. The Youth Risk Behavior Survey, or YRBS, was developed by the Centers for Disease Control and Prevention in 1990 to monitor the prevalence of health risk behaviors among youth. The survey was first conducted in Alaska in 1995. It is a joint project of the Alaska Departments of Health and Social Services and Education and Early Development in cooperation with the CDC. The 2017 Alaska YRBS questionnaire includes 114 questions on 6 main topics: unintentional injuries and violence, tobacco use, alcohol and other drug use, sexual behaviors, dietary behaviors, and physical activity. The YRBS is an anonymous and voluntary survey of students in grades 9 through 12. It is completed on paper in 1 class period. The Alaska YRBS consists of 4 surveys run simultaneously: a statewide traditional high school survey, a statewide alternative high school survey, a statewide correctional high school survey, and a local traditional high school survey. Schools are selected for the statewide surveys, but every school district has the option of conducting a local survey, which provides community-level data. All students complete the same questionnaire. The 4 surveys just collect different information about different student populations. Several different strategies are used to select survey samples, including probability and census sampling. The statewide traditional high school survey uses a 2-stage cluster sample design. Schools are selected with probability proportional to school enrollment, and then classes within each school are randomly selected. For the statewide alternative and correctional school surveys, all students are selected for the survey. Most school districts that conduct a local traditional high school survey also survey all students, although several large school districts randomly select a sample of students from each high school. In total, about 7,000 Alaska students from 30 school districts participate in every YRBS. CDC requires a minimum overall response rate of 60% for the statewide traditional high school survey results to be representative, and a minimum of 50% is required for all other surveys. High response rates can be difficult to achieve in Alaska because Alaska is an active consent state by law, meaning parents must provide written permission for their student to participate in the survey. If the minimum response rates are met, survey results are weighted, so the results are representative of the population. The YRBS has a few limitations. The survey relies on self-report, and the results represent a snapshot in time, so they can't be used to determine cause and effect. The YRBS does not survey students in correspondence or homeschools, charter, private, and boarding schools. And in Alaska, because of active parental consent, we don't survey students who haven't returned parental permission forms. In addition to overseeing YRBS administration, the Alaska YRBS program creates a highlights report every YRBS cycle. The 2015 YRBS highlights report was just completed and will be available on our website within the next week. It includes a summary of results as well as trend information and comparisons with national results. We also produce district and community level reports for school districts that conduct local surveys. And we also accept YRBS dataset and analysis requests from individuals and organizations. YRBS data are used in a variety of ways by many state programs. Some of these state partners include the Alaska Mental Health Board, Tobacco Prevention and Control Program, Department of Education and Early Development, and Division of Juvenile Justice, just to name a few. In addition, a large group of community stakeholders rely on the Alaska YRBS, including tribal organizations, community foundations and coalitions, and researchers. I'm going to detail just a few of the ways state and community partners use YRBS data. Earlier, Alasa mentioned AK-IBIS, Alaska's indicator-based information system for public health, and Instant Atlas Health Maps. These are also great resources for YRBS data. The AK-IBIS website provides an interactive YRBS dataset, and Instant Atlas Health Maps displays YRBS data in graphs, tables, time series charts, and in maps by geographic region. The YRBS is also used to measure progress towards Healthy Alaskans 2020 health goals. Healthy Alaskans 2020 is a joint project of the State of Alaska Department of Health and Social Services and the Alaska Native Tribal Health Consortium. Of the 25 Healthy Alaskans 2020 health indicators, 8 are YRBS measures. Alaska YRBS data are often used in community needs assessments as measures of youth health. The two shown here are examples of needs assessments that have been conducted recently in Alaska that have incorporated YRBS results. State and community partners use YRBS data to inform new or existing programming. One example of this is the Alaska Wellness Coalition's BU campaign, a statewide media campaign that focuses on preventing and reducing underage drinking. This campaign utilizes alcohol use measures from the Alaska YRBS to combat the misconception that most teens drink. Many of our partners conduct evaluations, and YRBS measures help these organizations track their progress and assess the effectiveness of their programs. One example of this is the Alaska Tobacco Prevention and Control Program's evaluation process. The Tobacco Prevention and Control Program uses Alaska YRBS data to understand youth tobacco use in Alaska, inform program activities, and evaluate their progress for federal grants. If you're interested in learning more about how they use YRBS data, check out the Alaska Tobacco Facts document. Many state and community partners rely on grant funding, and YRBS data are often used in grant applications. As an example, the Alaska Department of Education used YRBS data in an application for a $9.4 million 5-year grant they recently received from the Substance Abuse and Mental Health Services Administration. Some exciting changes are taking place with the YRBS program, including a public awareness campaign. Goals of the campaign include educating students, parents, school teachers and administrators, and community partners about the YRBS, encouraging parents to complete YRBS permission forms, and getting students to participate in the survey. As part of this campaign, we've developed YRBS toolkits for schools and community stakeholders. The toolkits include a YRBS poster and rack card, a frequently asked questions document, a variety of 2015 reports, as well as informational materials. We're collaborating with community partners. We're especially excited about the Spirit of Youth audio and video PSAs, encouraging teens to get parental permission to participate in the YRBS. You can find the video PSA on the Alaska YRBS website, and it's also included in the YRBS toolkits. We've also created a student information and resources brochure that will be given to students who complete the 2017 YRBS. And not new this year, but certainly worth mentioning, due to the generous support of our partners, school districts that participate in the 2017 Alaska YRBS will receive financial support to help cover survey promotion and administration costs. If you're interested in learning more about the YRBS, I encourage you to visit the Alaska YRBS website. You can find information about the survey, frequently asked questions, the 2015 highlights report, and survey results by year. We also have links to the AK-IBIS and Instant Atlas Health Maps websites, and Instant Atlas was just updated with 2015 YRBS data. If you're specifically interested in Alaska statewide traditional high school results, the CDC's Youth Online website is a great resource. You can compare Alaska with other states and national results on specific YRBS measures. And if you're not finding what you need or have a specific data request, send an email to yrbs@alaska.gov. And that email address is also available on our website. We're always happy to answer any questions that you may have. Thank you so much for supporting the Alaska YRBS. And I think it's time for some question and answers.
So feel free to type your questions in if you don't have audio, or else unmute your phone or speak into your microphone if you have questions. And while we're waiting for questions to come in, this is just a reminder that we will be posting the webinar and PowerPoint presentations on our section's webinar website within the next week, and we'll also send those out through an email to everyone who's registered for this webinar.
I have a question while we're waiting for the questions to come in. If a community organization, and this is for you, Kaz, if a community organization was interested in helping with YRBS, how would they get involved?
Great question. So the first step would be to reach out to the YRBS program. We will help connect you with the YRBS coordinator or the superintendent in your school district. And we really want to help facilitate that communication between community organizations and the schools. And then we have some community stakeholder guidance documents, some information for how you might be able to help with the school districts implement the YRBS. And we have, as I mentioned, a community toolkit. So we have some promotional materials, a poster, rack cards, frequently asked questions document, and we have the PSA I mentioned that you could use in your community, and just a variety of materials. So I would recommend reaching out to us, and then we will help you make contact and get you the information you may need.
Thank you.
We do have a couple more questions coming in. One says, what sort of data is collected on disability prevalence in Alaska?
Hi, this is Alasa. There are questions collected by the BRFSS on disability, and I would be more than happy to compile a list of the questions that have been asked in recent years and then questions that have been asked historically. You can also find some of these indicators on Instant Atlas. There will be a section where you can actually customize your query to look up information on disability, and then you can stratify that by different variables like race or ethnicity or region. So Instant Atlas is a really neat way to look at disability data. But if you would like just an idea of what questions have been asked presently and then in the past, I can definitely provide you a list of all of those questions from 1991 forward.
Another question has come in about whether parents give reasons for not consenting to the YRBS.
That's a really good question. I would say we don't really have a clear understanding of why parents don't provide consent. I think that there perhaps is a lack of understanding about the YRBS and the value of the YRBS data. So one of our goals is to, with our public awareness campaign, is to reach parents and help them understand the value of the YRBS. I think some are concerned about what questions may be asked, but we don't really have a clear understanding of why they wouldn't provide consent.
Another question has come in about what are the size regions that the YRBS and BRFSS information, what are the size regions those are available for?
So I'll go for the YRBS. So if a school district chooses to conduct a local survey, then they will have district level results. So it depends on the school, on the area you're talking about. The districts that don't participate in the local survey, we don't have that community level data. So it really depends on areas of the state that participate in the local survey. And like I said, every district has the option of participating in the local survey.
Now, Lassa, do you want to answer that question for BRFSS?
Yeah, sure. So the Alaska BRFSS regions that we use in our strata, we have 6 different regions, and they include Anchorage municipality, Matsu, Gulf Coast, Southeast, Rural, and then Fairbanks and vicinity. And you can see a detailed breakdown of all of the communities included in those areas on the AKBRFSS website. If you go to the AKBRFSS website, on the left-hand side, there's a link that says BRFSS maps and regions, and it'll give you a breakdown of all those communities and how they're grouped together in the regions. But we do have those 6 distinct regions, which we also refer to as strata. Ideally, we would have 500 completed interviews in each strata every year. Recently, that has become more of a challenge given reductions in federal funding, but that's historically what we have aimed for.
Thank you, Alasa. That brings us to the end of our time here for this webinar. Thank you to Taz and Alasa for presenting today. As a reminder, this will be put online within the next week and sent to you all for further review. And thank you all for your time today.